So what are the most common causes for infertility?
I want to convey the message that male infertility is equally on the rise. Lifestyle, recreational drugs, alcohol, nicotine.
Is it really hard to conceive after 30 or 35?
Age is the most important factor when fertility is concerned, especially for females. In our day-to-day OPD clinic, 1 in 3 woman has PCOS.
Your health, your story. Let's make it extraordinary. Hi, I'm Dr. Manasa Reddy. Today we have Dr. Aishwarya Garu, gynecologist and fertility expert with us. Let's welcome her. Hello, ma'am.
Thank you for having me here. Hello.
Is IVF more successful than IUI?
Depending on the indication for that couple, IVF cannot be blanket. The treatment has to be tailored according to the need of the couple, at what age they are, how many years of married life, what is the present status of their sperms and eggs, the fallopian tubes, the uterus. In IUI, the procedure is we inseminate processed semen sample inside the woman's uterus.
Okay.
So the chances would be around 15 to 20%. But in IVF, we retrieve the eggs, we fertilize it with the sperms, we form embryos.
Okay.
So we have bypassed a lot of steps, and morphologically good-looking embryos are transferred into the uterus. So the chances would definitely be up to 40 to 50%.
Okay.
So IVF definitely has better chances than IUI. Yes.
So what are the chances of twins in IVF?
Chances of twins in IVF are definitely higher than natural pregnancies. The reason being, many a times more number of embryos are transferred into the uterus, and especially for young females whose egg quality is good, the implantation would be higher.
Okay.
And twin pregnancy is a high-risk pregnancy. So we as clinicians, we need to be more responsible and transfer less number of embryos. And now the concept of single embryo transfer, SET, is being practiced, especially if we have tested the embryo for any genetic abnormality. So euploid embryo means a genetically normal embryo. Only single embryo can be transferred, and we can reduce the incidence of twins in pregnancies.
Does birth control pills affect fertility?
No, not at all. The birth control pills, they affect the hypothalamus pituitary from the brain, which releases hormones to produce eggs. So as long as we use the pill, that system gets suppressed. When we stop the pills, within few months, most of the women, they resume their previous menstrual pattern and they can conceive. So if after stoppage of the pills within 6 months to 1 year, still they are not able to conceive, then they should seek consultation. But temporary usage of birth control pills definitely does not affect fertility. It resumes all the reproductive functions, they resume after stoppage of the pills.
Is it really hard to conceive after 30 or 35?
Age is the most important factor when fertility is concerned, especially for females. So after 30, it declines. After 35, there's a sharp decline in the ovarian reserve. So, and even the fallopian tubes, they can get infected, and there could be fluid accumulated in the tubes, which is called hydrosalpinx. The uterus, as the woman ages, it can have fibroid, it can have adenomyosis, there could be endometriosis. So, as we age, definitely it becomes difficult for the woman to conceive, and not just for women, even for men after 40, 45, even their semen parameters in terms of count, motility, and shape get affected. So earlier, the better.
Why does egg quality decline with age in women?
So egg quality declines with age in women. We all know that. Why? Because of chromosomal abnormality, the aneuploidies. So as she ages, she will have less chances of conceiving. She'll have more miscarriages because these eggs have chromosomal abnormality. And also, the offspring can have more chances of genetic diseases.
What is an AMH test and why is it important in fertility?
AMH is anti-Mullerian hormone. It helps us to know how many eggs are left in her ovaries at that point in time. And also, AMH helps us to predict her response to fertility treatment. This helps the clinician to form a tailored treatment plan for each woman. High AMH will be seen in PCOS patients, low AMH in advanced maternal age who have diminished ovarian reserve, and also in young women with premature ovarian insufficiency. So the AMH levels also to some extent help a woman to know how much time she has in hand before she can plan for the family.
Is this test only for women?
Yes, it is only for women and for her ovarian reserve.
Okay.
And it only tells the quantity that she has. It cannot tell us about the quality of eggs that are present.
Okay.